It's been a rough week for Tylenol.
Don't take Tylenol. Don't have your baby take Tylenol.
But in all seriousness, is there a real link between acetaminophen, which is the generic name for Tylenol, and autism? During a press conference on Monday, President Trump emphatically suggested that taking Tylenol when pregnant could lead to a, quote, very increased risk of autism. There's a lot to unpack here, and my stat colleagues are here to explain what's going on.
This is a case where there's substantial disagreement on whether Tylenol is causing any increased risk of autism. And even from proponents, I think that some of the claims about how much this could be causing increase, this Tylenol, if there is an autism epidemic, which is a subject of debate, Tylenol could not be causing it. We know that. It is possible for drugs given during fetal development to have an effect on autism. But the data here are very muddy, and there are studies that show some association, some very clever studies. And there are studies that seem to suggest that association may not actually be the result of Tylenol being the cause, but instead that having headaches, having more pain may all actually be indicative of underlying genetic risk. There's a lot to tease out and a lot that we don't understand. Human beings are storytelling animals. We like to think that thing A happens and it causes thing B. But the world doesn't always work like that. And often thing A and thing B are being caused by other things or just happening by chance. Ice cream consumption increases at the same time as sunburns and shark attacks. That does not mean that ice cream is causing either sunburns or shark attacks. We all know they all happen because it's summer and people go to the beach and eat ice cream because it's hot. The same thing could be happening here. It could be that fevers or migraines or other indicators in a mother could predispose a child to developing autism. We can't really say for sure just because autism increases in cases where there's increase in Tylenol that they're causative. And again, we're not talking about huge substantial increases. We're talking about small risks that are kind of hard to tease out.
What does this announcement say about RFK Jr.'s influence and place in the Trump administration?
It certainly shows that Kennedy is a trusted advisor or trusted by President Trump. It was clear that they had a very cordial relationship yesterday at the White House with, President Trump, patting Secretary Kennedy on the back before he made his comments, referring to him as Bobby, his first name. And these specific comments or suggestions that he made around the childhood vaccine schedule related to MMR, related to hepatitis B, he says he spoke with Secretary Kennedy about.
I think it shows that both men are in sync in their own views, that they both feel that they're outsiders, that they can't be trusting the scientific community or trusting the status quo, that they have to figure out for themselves. These are things that Trump has been saying for decades, but they're really coming to the forefront, especially now that he has a health secretary who also has been saying similar things for decades. It's interesting that President Trump both says that I'm not a doctor, I'm just speaking for myself. He even said at this announcement, I am not as careful in what I say as some of the officials behind me. At the same time, he's the president, and this president in particular is known to very strongly want his way to be put out through the agencies, often in ways that previous administrations would consider off limits. So I think there's going to be a lot of people watching and waiting to see how do these beliefs, which, let's be clear, if they are enacted, would really be a historic, monumental change in public health in this country and how lots of kids get lots of vaccines. Whether the health agencies are going to follow through with policy.
Mm-hmm. And of course, as a patient, how do you reconcile the most powerful person in America coming on television saying, don't take Tylenol, or giving a medical advice, even though he says, I'm not a doctor, this is just my suggestion. It creates a lot of confusion and a little bit of a tight spot for people of who do I trust. One thing I will say about the announcement yesterday regarding at least autism, They were referring to a Harvard review of multiple studies that found an association between a certain limit of Tylenol, which is a high amount of Tylenol, over a 4 week span or more. It's worth noting that while FDA Commissioner Marty McCary did say during that press conference that there was a causal link found or a correlation found, these review authors have said more research is needed for that. So it's important to note that because these are, again, powerful federal officials, top doctors. McCary is a doctor, saying there is this link, and the research doesn't necessarily say that. So again, that confuses people. It can be hard to, you see that on TV. What are you supposed to do? Not believe it?
It's maybe helpful to note that for Tylenol, there is some research on this, that it's inconclusive, it's not causal, it's a complex issue. For the issue of spreading out vaccines over 4 or 5 years, or removing or separating measles, mumps, and rubella into separate vaccines because there's some intuition that it's unsafe, there is research, and a lot of research to the contrary, that that's just not true. It's not up for debate among any experts I've talked to. And I think that distinction is helpful, especially when so much news comes at once. And in fact, I was talking to a White House official just before I hopped onto this, who said, a lot of people take the president literally, a lot of people take the president figuratively. And I asked, well, which one should we take out of this conference? And the person said, well, I guess both figuratively and literally. There's some truth, but some of it's figurative. So if that helps clear things up, it didn't for me.
No. The opposite, quite the opposite, in fact.
Yeah, and even in addition to that, the suggestions that the president had made about delaying hepatitis B to 12 years, separating out the MMR vaccine. Sure, some people have discussed that, but that wasn't exactly what was being discussed by HHS vaccine advisors last week. They were talking about delaying the hepatitis B shot, but 1 month from when a child is born, not 12 years. So it's a new realm, and what does that mean, and who actually is listening to that is a really important question.
So, Rose, you've spoken to some folks from in the autism community. What's their reaction to all this, Ben?
Fundamentally, the autism community is really struggling right now. They've had months of Health Secretary Kennedy basically being like, we're going to figure out the cause of autism by September. We had a lot of people denigrating our community. A lot of autistic researchers have had their grants slashed at the NIH. Several of the most powerful men in the entire world who run the American healthcare system and the recommendations that we give around medication and around our vaccines, all these things, basically saying that autism is not only people run the risk of getting it, kids run the risk of getting it with acetaminophen use, but also that autism is a thing that you would never want to have, which is just so against what so many people in the autism community talk about, which is that, like, yes, autism is a different way of being in the world, but it's not something that we should see as mobilizing the entire federal health infrastructure to prevent. There are many, many, many different genes that are indicated in autism. And so when researchers are trying to understand, hey, what genetic factors are leading to autism, that's a hard question to answer because there's tons of genes involved. And so when, Secretary Kennedy is like, hey, we're going to find the cause of autism, it's like, oh, well, we've been doing that for decades and we still we have like a pretty good idea of that it's genetic and based and maybe influenced by some environmental factors, but again, mostly genetic based. But I think what also makes it tough is that the presentation is different. I have a friend who doesn't have a ton of support needs, has been diagnosed with autism, is like working at a corporate job, and like, yeah, being autistic affects their life, absolutely. but there are also people who are autistic who have higher support needs, who need a full-time caregiver, or have more behaviors that make it tougher for them to have a corporate job, like my friend. And like both of those are autism, but the way that they are expressed genetically, the way that the different sort of health needs that they have, it's why painting a broad brush by the secretary, so many of the people that I've talked to have just been flabbergasted by what he's doing, because it's just like, that's not true. That doesn't feel true to the way that the autism research and the way that the autism community and autistic people experience autism.
I want to give a big thanks to all my stat colleagues that just came on to help explain this all. If you like this video, please consider liking and subscribing. We'll be back next week. Same stat time, same stat channel.